Dr. Deere, it's a pleasure to have you here.
Thank you,
at,
sir.
The Spinal Simplicity National Lab. Want to take a minute to talk to you about kind of your evolution with SI fusion. You were one of the first into the space with the posterior approach, and you've recently become more acquainted with Liberty SI and our lateral approach. So can you kind of tell everybody how you've kind of come and evolved with respect to the lateral approach?
Yeah, I think the evolution of SI joint treatment has been fascinating to me. So in my 30th year of practice, we used to inject the joint. And early in my career, there were some large attempts at fusion. And those attempts were unsuccessful. Ortho-spine colleagues would tell me that. And so it went away for a while. Came back with a 3-screw approach, as you may know. I was not an advocate of that for interventional spine and pain physicians to do. I thought the risk-benefit profile was not favorable. And then we went to posterior approach, which I've had great success with in a lot of patients, and I still do that approach quite often. And then I was really talking with you, and we started talking about ways to make the lateral approach safer. And I think the Liberty accomplishes that in a lot of ways because we're coming in above S1. We're coming in a very, really textbook way, always the same way, based on radiological landmarks. And so the reproducibility of that is fascinating. And the fact that we can open up those wings and really give a closure of the joint and see that occur really gives us a lot of confidence, I think, in what we're seeing. So I think this is a revolution for a lateral approach. I think it's really going to help a lot of people. And I think these types of labs where we teach safety and patient selection are so critical for our field. So patient safety and efficacy are always first. And there's so many things built into the engineering of this that are safety driven. The way you measure what size to put in, the way you stop going past a certain point so you can't have an injury. All those things, the safety engineering has been fascinating. So compliments to you and your engineering team, great job. I think we're gonna help thousands of people in the United States, and then I think in the future, over into Europe and Asia, Australia, I think we're gonna see this expand.
Absolutely. Well, thank you so much for your perspective and all your help.
Thanks for having me. It's great to be here, and I look forward to really seeing a lot of people do well with the collaboration.
Thank you, Dr. Deere.
Thank you.